Knee replacements are one of the most commonly performed procedures in the U.S., with over 700,000 happening each year. During a knee replacement surgery, your surgeon removes the arthritic and damaged cartilage and replaces it with metal components in the thigh and shin bone with a plastic spacer in between, acting as the articulating surface. To remove the damaged arthritic cartilage, your surgeon will make several bone cuts into your thigh and shin to properly prepare the bone for the implant. To secure the implant, some patients require the use of bone cement for fixation, while others are press-fit requiring no cement at all. Once the impact is secured and the plastic spacer is locked in place, your surgeon will resurface your kneecap if necessary, and the final step of the procedure will be complete. Most patients return to normal activities within 6 to 9 months. Start your patient pathway with Right Device today. Wanting more information about your upcoming surgery? Join us at rightdevice.com to get everything you need to feel prepared for your upcoming surgery today.